Thank you for joining us for NBC Augusta 26 Morning News at 11 a.m. Osteoarthritis is the most common type of arthritis and affects nearly 21 million Americans. Here to tell us the signs and symptoms of osteoarthritis and how to prevent it is Nancy Raborn of University Hospital. Good morning.
Good morning.
Good to see you.
Good to see you.
Now, what exactly is osteoarthritis? You tell me there are hundreds of different types of arthritis, but this is the most common type.
That's right.
Okay.
Osteoarthritis is the most common type of arthritis that does affect nearly 21 million Americans, and it can occur in almost any joint in the body.
Okay.
It's associated with a breakdown of cartilage in the joints. When cartilage deteriorates, it allows the bones to rub together, causing friction and pain. It most commonly occurs in the weight-bearing joints of the hips, knees, feet, and ankles, but it can also be seen in the joints of the fingers, the wrists, the shoulders, and the spine.
Okay, that does not sound comfortable. So
No.
the symptoms have got it. Are they severe? Can you really tell when you have this?
They can range from mild to severe, depending on the degree of the disease.
Okay. So what are the symptoms? What do we need to be looking out for?
Well, the symptoms of osteoarthritis are swelling. You may see a swelling in the affected joints, limited range of motion and flexibility in the joint, joint stiffness and pain. Mr. Jeffries, weather changes such as cold and damp may increase the aching.
Okay.
Crackling noise in the joints, crackling or grating noise from the bones rubbing together. And usually with this type of osteoarthritis, you don't see redness and heat in the joint like you do with some of the other forms.
Well, some of those sounds, I don't think I want to hear crackling or grating sounds. That has to be not a good feeling when you start to hear something like that. So what are the risk factors for developing this type of arthritis? Are some more susceptible than others? Or
They are. The risk factors for developing osteoarthritis, of course, are age, just the simple wear and tear on our bodies over the years. 50% of people over the age of 60 show some signs of osteoarthritis.
Oh, wow.
And heredity, there are some people that have an inherited defect in one of the genes responsible for making cartilage. Obesity is also an increased risk. It increases the risk for osteoarthritis of the knees and the hips. Again, the weight-bearing joints. Joint overuse. Overuse of certain joints increases the risk of developing osteoarthritis. And injuries. If you have a history of an injury, that can contribute to a possible development of osteoarthritis in the future.
Okay. So are there certain things we can do to prevent osteoarthritis, or as we age, is it just almost inevitable that we're going to get some form?
Well, you can prevent it by being physically active, but avoid any activities that may lead to a joint injury, and also avoid being overweight.
Okay. And from what I understand, for it to be treated, are you on medication? I mean, they don't really replace your cartilage.
Well, no, the treatment goals would be to control the pain, and also to improve the function and mobility, and slow the progression of the disorder. So if we can do that, then we've done something. And basically, those things can be done with lifestyle changes, medications. There are good medications out now, self-care steps that you can do, and possibly surgery.
Okay, well, great. Thank you so much for being here.
Thank you.
For all the information. Of course, you can always dial Ask a Nurse if you have any other questions for Nancy or any of the other staff at University Hospital.
Thank you.
See you next week.
All right.
For Masters Week.
Yeah, that's exciting.
We'll see you then.
Thank you.